Hi guys, I'm really excited to be here with you all. As Kelsey mentioned, I am in my 22nd year of practice. I started with a goal of initially trying to work with and help the chronically ill population. And it didn't take very long after beginning medical practice to realize that chronic infectious illness, like tick-borne illnesses, are a underlying driver for a lot of people suffering with chronic inflammatory illness and degenerative conditions, as well as this whole array of functional issues from like fatigue and joint pain and things that a lot of people are familiar with, but that the traditional medical system has really very little to offer other than symptom relief. So, like I said, it's an honor to be here with you guys to share some of what I've gathered over these past few decades in working full-time treating patients with tick-borne illnesses. So without further ado, let's
Thank
get
you.
into things.
Yes, please. All right. So I have a handy map for you. It might be a little overwhelming, and there's two Americas, as if one wasn't enough. Will you explain what's going on this slide for us, Cory?
Yeah, so this is actually really an interesting introduction to this whole topic because it highlights the division of awareness that exists between what you might think of as conventional or CDC-based recognition of Lyme and compared to the experience that we're seeing out in the medical field and with people suffering with these conditions. On the left side, you'll see the CDC map. That's actually the 2023 map. And it's interesting because it really hasn't changed much over the last 2 decades. It still shows a concentration in New England and the area of Wisconsin, Michigan, those states around the Great Lakes. And a lot of this has to do with the criteria for reporting. You'll see that it goes from a test, the testing, there are certain recognized tests, and we'll get into that in a little bit. But those recognized tests go to the county once they're positive, if they meet those criteria, and then the county actually decides whether they're going to report that to the state or not, which then has to report to the federal government. But what we're seeing with this is a lot of disawareness amongst healthcare providers. In the areas of dark blue, we know that providers are more aware of ticks as a concern, and so people who end up getting like symptoms like flu-like illnesses, things like that after they've been outdoors, those providers are more likely to test. Whereas if you live in other areas of the country, like the West Coast is an example where we still see a lot, or along the Rocky Chains, or really anywhere, a lot of providers just don't actually think of testing for Lyme, or they're very dismissive of it. And that brings into account the second map on the right, the Google Analytics map. The Google Analytics map is really interesting because it's really representing the testing, the reported positive results from testing facilities. And that's not just standard two-tiered tests, which again, I'll get into in a little bit here, but it can include direct molecular tests like immunofluorescence or PCR, things that also will be recognized. You can see that there's some odd little natures to it. You'll see a little red spot in certain areas, and that really highlights again like population density or the county's decision to report or not. But the key that you'll see underneath that map is based on, as you see, percentage change. And I think it's really interesting to note that if you compare it to the CDC map, you'll see that in New England and along those Great Lakes areas, we're not seeing huge shifts in the increased percentages. It is increasing for the most part, and a lot of that can be due to a whole host of factors, from migration of the tick host to global warming and other things. But what you'll see is the pinks are in like Arizona and Oregon and Washington and the Midwest. And what it's actually showing is that there is increased awareness. There is mostly amongst patients, people asking to be tested, and those people are testing positive. And so you're starting to see the disparity between what we're actually hearing from the CDC on the left and what we're actually seeing as positive results from the labs themselves. This ultimately, like I said, highlights that tick-borne illnesses are actually a national issue, and they're in virtually every state at this point. So it's, where you live, you're not immune to potentially getting these infections.
Yeah, no, it's really insightful. Thank you so much for bringing up these maps. With Cory's help, I was able to put together this presentation. It's so hard to imagine getting Lyme in states like Arizona, Nevada. As we're looking at the map, type in the chat where you're from if you haven't already, or type my state if your state is affected. And I'm
And
going to
I
type my
should,
state in here too, because I'm from Michigan and we're affected there. So type
yeah,
in my state, Cali. Thank you. If you're from California, my state. Yes, thanks, Heather.
and I'll say I'm from Oregon, and I'm in Southern Oregon, where we see some of the highest density of
Yeah.
tick-borne illnesses, Northern California and Southern Oregon. And I should also tell you, one of the reasons for this disparity as well is that the CDC still really only is looking for Borrelia burgdorferi, which is a very specific species of Borrelia. But there's a lot of species of Borrelia. There's, the relapsing fever species, and then there's a whole host of other species that we fall under the Lyme category, like Californicum and Afzelli and Gardini. And these can be in other states, but they're not going to be picked up on testing, and they're not going to be reported for that reason. But people have the same symptoms, and the treatment ultimately is going to be the same, regardless of whether you have big Darfry or not. So
Mm.
ultimately, what we're willing to do is get testing that's going to show us more accurate sensitivity for Borrelia as a genus overall, or for labs that can test a wider array. And again, I'll get further into that. I don't want to get too far ahead of myself.
Thank you. Well, yeah, before we dive into all of that, let's go to back to the basics. Let's talk about, for some of us who have never encountered a tick before, believe it or not, some of us do exist, even though it sounds like it's increasingly difficult to avoid them when going outdoors nowadays. Walk us through what to do in the event we find a tick on ourselves or on someone we know.
Yeah, I think it's increasingly rare to find people who haven't had tick bites. And of course, no one's immune to it. So if you're going outdoors, you don't want to avoid the outdoors for fear of it. You just want to be smart about it. Ultimately, the nature of removing a tick is you don't want to squeeze the tick's body. Okay. So you want to use tweezers, easy to get, easy to put in your camping kit, or you can get something more specialized like a tick twister or a tick key. But you want to grab the tick down at the base by the skin, at the head, and pull it straight out. That way, you're not actually squeezing the thorax. The risk of doing that is the tick itself is the harbor of these infections, all the variety of bacterial, viral, and protozoal infections. And so when you squeeze it, or you use something like Vaseline or a match, or people put gasoline or other things like that on it, you're actually going to cause the tick distress, and you're going to find that the tick is more likely to sounds bad, but regurgitate into you, and you're more likely to get some sort of infection from the tick by inadvertently trying to pull it off and not doing it in the right way.
Thank you for that very, very nice description. And yes, absolutely. These are some tips that we need to take with us whenever we're going outside. Let's go into a little bit more about the great imitator. I've heard this phrase before. Tell me what it means when we talk about Lyme as the great imitator.
Yeah, it's interesting because the great imitator, that moniker was originally ascribed to syphilis, right? Back in the day when it was a more predominant illness. We don't see that anymore, but Lyme is a spirochete, just like treponema. So they're similar organisms. And what it means ultimately is that Lyme affects people differently. And it highlights treatment, it highlights the need for diagnosis, and it highlights the need for more awareness amongst healthcare providers, because everyone wants to think that there are certain specific symptoms associated with Lyme, and certainly those symptoms do account for the majority of people in these symptoms, like joint swelling or redness. But ultimately, you can find, from an individualized perspective, it can present in a whole bunch of different ways. There's neuromuscular issues, there's vascular issues, there's skin or urticarial or hive-based things. It affects the GI tract in some people. And so what ends up happening is, because our medical system is so fragmented and very mechanistic, you see all these different ologist, you might be ascribed to one person who's going to say, we diagnosed you with fibromyalgia, or you have autoimmune markers, which are honestly pretty common to see in people with tick-borne illnesses, which we could get into for why. But so people will be diagnosed with lupus, or they'll be diagnosed with scleroderma, or you end up seeing these neurodegenerative diagnoses like Parkinson's, or myalgic encephalitis, or reflex sympathetic dystrophy, polymyalgia rheumatica. Like the list goes on and on and on. And ultimately, what these diagnoses represent is an end-stage observation of symptoms. And it's not to say that the person who's making the diagnosis is completely wrong, but they're not addressing the cause or the original reason for these issues. And people end up in this cycle of getting symptomatic treatment, which may give partial relief, but ultimately you end up in this sort of spiral of polypharmacy, where you keep adding more and more medications to deal with more and more symptoms, and ultimately things progress. So this slide really just highlights that Lyme can present in a variety of different ways and affect everyone individually. Right. So Borrelia, I sort of talked about this earlier. Borrelia burgdorferi is the official CDC recognized organism for Lyme bacteria. It lives in a lot of different hosts, a lot of rodents, so mice, chipmunks, squirrels. We also, of course, know deer are the big ones, but birds is something that wasn't accounted for, and may go all the way back to the original observation of Lyme, and that birds are actually one of the primary reasons for seeing the spread of Lyme throughout the country, because ticks are attaching to birds and then those birds are migrating. Lyme Borrelia is primarily transmitted by Ixodes, the black-legged tick. That can be there's different versions of it across the country. But I really want to take this moment to highlight the fact that while we think of Borrelia burgdorferi, or I would say officially, as being the reason for Lyme, the truth is Borrelia as a genus, as I said, is really going to represent the combination of Lyme and tick-borne relapsing fever. Ultimately, you're going to see the same symptom presentation with almost any Borrelia infection that can come from a hard tick like the deer tick, or you can see it from dog ticks, you can see it from Lone Star ticks, or you can see it from soft-bodied ticks, where you get things like Borrelia hermsii. So ultimately, Lyme can come from any Borrelia species, and it's important to know that, because when you get tested from your primary care, a lot of times, and you do that through Quest Labs or LabCorp or one of these standard reference labs, they're only testing for Borrelia burgdorferi, the B31 lab strain, and it's one reason why we see all these false negatives. And I think that'll be on a slide coming up.
Mm-hmm.
Okay, so Borrelia is the first of the three Bs, and I kind of talked about that. Ticks are reservoirs of infection, and they carry a lot. Today, I'm really going to focus on what I call the three Bs. That is to say, there are things that I'm not talking about because we just don't have enough time. So Ehrlichia, Anaplasma, Rickettsia, Mycoplasma, Chlamydia, all bacterial species that you can get from a tick, but maybe not as common or more easily eradicated. I think there was actually one study that was done that showed that there was well over 200 potential pathogens within a tick, kind of a frightening number to know, especially considering how many we can actually test for. But the second of the two Bs is Babesia. Babesia is not a bacteria, it's a protozoa, or a single-celled parasite, and its closest relative is malaria. It, just like malaria, infects red blood cells and uses a red blood cell as a reservoir to reside in the body. In terms of where you find these, you'll find that Babesia is just like Lyme in mice and small mammals. You can see it certainly in deer as well. This is something that in areas of the country where we don't see Lyme as frequently, like say the Southeast in like whatever, Georgia or Florida or areas like that, or even in Texas, we may see higher amounts of Babesia, in fact, than even just Borrelia, because it's present in other tick species like dog ticks more commonly, or in Lone Star ticks. Um, Even though, again, of course, Ixodes is going to be a primary carrier of all of these, and that's why it's highlighted in these slides.
Mhm.
And the third of the three Bs is Bartonella. Bartonella is another stealth bacterial pathogen that a lot of you may have heard of already. It resides in blood vessel linings and red blood cells. It tends to like those blood vessel linings, and in terms of symptoms, it often affects the tendon insertions. In Lyme, we often think of as joint pain, because Lyme is a selective anaerobe. It's an organism that doesn't really like oxygen, so it'll go into these deoxygenated regions like our joints, which is one reason we see so much joint-related symptoms in people with Lyme. Bartonella often will infect the areas around the joints. But ultimately, reservoirs for this include cats. It's a big one. This is Bartonella is cat scratch fever. So you can get it from something other than a tick bite. And in this case, and even if we again look at the CDC, there's still limited recognition that ticks are primary reservoirs of Bartonella. It's more thought of that fleas and lice and other, biting organisms are more commonly associated with transmission of Bartonella. But we know that ticks, like Ixodes and others, are definite drivers and definite contributors to Bartonella. And I love this picture because it shows the stria. A lot of people don't realize that one of the symptoms, or I shouldn't say symptoms, one of the signs of Bartonella are these like stretch marks, and we call them stria. And they often appear in areas of the body where you wouldn't traditionally see them for, periods of weight gain or weight loss. And a lot of people just dismiss these stria because of that idea that, oh, I went through a period of weight gain or sudden weight loss. Or they're in areas of our body that we don't often think of, like our low back or our upper thighs, where we're not, typically looking, or people aren't commenting. But if you're someone who's seen those sort of odd stretch marks, it can really be a big indicator of Bartonella.
Mhm. Well, all of this is really important to be educated on. Thank you so much, Cory, especially if we're new to the topic or to tick-borne illnesses. And maybe there are members in the audience today who didn't realize they had been bitten by a tick or contracted any of these three Bs. So their health is declining, they're showing these vague symptoms, but can't pinpoint the cause. And the journey through diagnosis and recovery can be beyond exhausting. Well, we have a surprise guest that I want to introduce to you today who walked a path like that one. She's persevered and found a path to healing that you're going to find inspiring. So, I have the pleasure of introducing our surprise guest, Heather Sunderland, who is going to share her personal story of how she restored her health after 22 years of suffering with undiagnosed Lyme, mold toxicity, and SIRS. By the way, and this is impressive, Heather is a board certified functional health coach who founded Health Coaching by Heather and the Navigating Mold and SIRS course for practitioners. Heather, we're so happy to have you here today.
Thank you, Kelsey. I'm so excited to be here. And I'm going to give you guys, as Dr. Cory told me earlier, the coffee shop version of my story because I was sick a very long time. So I grew up in Pennsylvania and I had two dogs and I was outdoors a lot, frequently had ticks on myself and my dogs, but never really thought much of it. By the time I was 30, I started to experience daily aches and pains along with some severe fatigue, and my pain was always moving around. I was eventually diagnosed with fibromyalgia and chronic fatigue, but the labels just kept coming and the symptoms kept getting worse. By the time I was 35, I stopped working as a dietitian because of the pain and fatigue was so intense. And then I developed just very severe daily neuropathy. I developed interstitial cystitis. I had a lot of gastric issues. I was actually homebound for 10 years. I could not tolerate the pain of riding in a vehicle. And eventually, my neuropathy was so bad, we implanted a spinal cord stimulator to block the pain to my brain, which gave me the ability to walk a little bit better and a little bit longer, but I was still really, really struggling to walk and stand. Despite all the diagnoses, no one could explain to me why I felt like my body was falling apart, and my symptom list seemed to grow over time. I struggled to really participate in daily life and to show up the way I had wanted. I could not travel to see family or to go on vacations due to the intensity of my pain. And it was really frustrating not having a name for what was going on with my body. People didn't understand, why I had a walker, why I had a wheelchair. It didn't make sense. It wasn't until I was 52 years old that I was actually finally diagnosed with chronic Lyme disease. And I did begin treatment and I chose to treat herbally and I herxed intensely and saw a huge reduction in my symptoms, but I was still not well. I still struggled to walk and stand. I still struggled to go up steps. I had severe ligament laxity. I was at the chiropractor 3 times a week. And as a result of these limitations, we moved across the country to Arizona to be in a 1-story home where when we got here, I was using a walker. I struggled to walk from the front door to my bedroom. And I actually entered health coaching school in 2019 from a zero gravity chair because I would actually go out of alignment if I sat in a regular chair just to try to figure out what was going on with me. And it was actually during COVID that my Lyme reactivated. I did not know that was possible. I really did not want to delve into getting myself super educated about Lyme. And that same month, I developed hyperthyroidism or Graves' disease, which caused me to be awake for 72 hours at a time. My heart rate was very, very elevated. Medications did nothing. And I blamed all of this on my Lyme disease. And I also had reactivated Epstein-Barr, and it was a very scary, dark season in my life, and it wasn't really that long ago. I worked with a lot of practitioners who specialized in Lyme, and we did IV ozone and 10 passes, but really nothing was shifting. And that's when I met a colleague who I think is on this call right now, who I'm very thankful to, who suggested I might be dealing with mold toxicity and chronic inflammatory response syndrome. And I'm so thankful she did. We tested and confirmed I had chronic inflammatory response syndrome. And for those who don't know what it is, it's really the toxic bucket of the body overflowing, which can happen from mycotoxins from mold or from biotoxins from Lyme and also from other toxins we're exposed to. But that caused me to remember that we had a water leak in our home in Pennsylvania. And my parents then informed me that my childhood home, my bedroom, had black mold stacky in the wall. So it all started to make sense, these issues that I had. And that when I got bit by a tick, even though I never saw that I had a rash, that my body and my immune system could not do the job to get rid of it. So it was a very difficult season. And I actually did find out I had SIBO, small intestinal bacterial overgrowth. Around that time, I started working with a practitioner who treated for Lyme mold and SIRS. And I was down to 10 foods that I could tolerate. I started treatment and nothing after 6 months of treatment had shifted in my health. Um, so I'm going to share the good part of the story for a little bit later, but I do want to tell you, I would not be here today if I had not restored my health. And I wanted to just share a little bit of how I was diagnosed with Lyme. My testing was maybe not typical to some other people's testing, but I had an ELISA and Western blot done. I did not meet classic CDC requirements for Lyme, but I did have Borrelia burgdorferi in my blood, and a holistic practitioner decided to treat herbally. And I went through, major herxing and did see huge improvement in my pain levels with doing that. And I also had a lot of kinesiology that was done that also verified when my Lyme was active and sort of alternative testing, not more the traditional testing. But I'm really excited for Dr. Cory to continue sharing about the rabbit hole of testing for Lyme disease. I know I'm going to learn from him, and I've really enjoyed learning from him thus far.
Yeah, we're going to go down the rabbit hole of testing. And I laugh a bit because I know for many of you, similar to Heather's story, and thank you, Heather, so much for just being here and for sharing that. Because I'm hoping it'll really resonate with a lot of the people who are attending today. And just know that you're not alone in any of this. If your loved one is the one who's struggling and suffering, they're not alone either. Thank you for showing up and being here for them. So, Dr. Cory, there's no one better than you to explain what it is, the rabbit hole with testing. So I'm going to leave it in your hands.
Great. And yeah, let me just reflect back and say thanks for sharing that story, Heather. You really described the complexity of virtually everyone suffering from chronic illness and what I see and the Venn diagram of my own practice. The idea that we're dealing with just tick-borne illnesses, while it happens in chronic cases, it's often there's something that breaks the straw that breaks the proverbial camel's back, and that there's other things. Your body has a certain capacity for a certain inflammatory load. And so, like COVID as an example, we saw a lot of people who had been in remission for years or decades even, suddenly reappearing in my office after having gotten COVID. Or we see the same phenomena like Heather mentioned with people who've had mycotoxin exposures or other, organic solvents. So ultimately, it's this interplay, a lot of times chronic infectious illness, which we're talking about today, and tick-borne illness, but environmental medicine is overlaying this. Immune dysfunction is a huge, huge portion of actually getting well and correcting that immune dysfunction. And then structure. I really love that Heather brought up this idea of hypermobility. We see a lot more of this issue, and ultimately your body, the mechanical nature of your body and how it affects everything else that I just talked about. So you don't have to have Frank Ehlers-Danlos to know that there's something else going on. But anyway, I know that this transition is on testing. So ultimately, why is Lyme so difficult to diagnose? I'll say the first thing is what I said earlier. Everyone's just looking for Borrelia burgdorferi. And when we look at a two-tiered testing, there's two parts to it. One is what's called the ELISpot, the ELISA, or the IFA, the immunofluorescent antibody, which is basically just a sort of blended up version of Lyme, and it's looking to see if your immune system reacts to it. They use what's known as the B31 lab strain for that. Ultimately, that's part of the reason why we see such poor testing, as you can see, because there's a lot of other Borrelia species, like I mentioned before, as well as as well as the fact, and I want to go back to that other slide for a quick second. Sorry,
Sorry, I'm
I
jumping the
hadn't
gun
totally
here.
finished it, but yes.
Back down the rabbit hole we go. Go ahead.
I'm going to go, and I'm just going to kind of, organically move through this. But if you got a different strain, if you got a wild strain, it may not show up positive. And then, of course, like the two-tiered criteria, the second part is that you have certain bands that are positive on a Western blot or an immunoblot. And those bands are going to be positive in some people, but often it's only for this sort of magic window of time. Generally, it doesn't happen at all in the first 30 days. And then after 6 months, we start to lose some of those bands. So unless you meet that perfect criteria of being tested within that, say, 6-week to 6 months period, a lot of people are going to be lost. Other things, of course, like formation of immune complexes, your antibodies bind to the organism, and so you may not see antibodies, the sensitivity I just discussed. And then Borrelia itself is able to exchange its own proteins. It's known as plasmids. So there's linear and circular plasmids, these little sections of DNA that bacteria have. And it's really interesting because Borrelia is by far the most complex bacteria we know of in terms of its capacity to exchange surface proteins, which is one way it can evade our own immune system. And it's one way that can affect the ability of testing to be accurate. Biofilm formation is huge. It's another thing we're going to be talking about when we discuss treatment. But Borrelia itself can shield itself in this sort of shell to evade our immune system. It's known as biofilms. Everyone's very familiar with biofilms in the dental world or like in plumbing and things like that, but it happens throughout our bodies as well. And quorum sensing is this process by which bacteria and other organisms actually converse basically or speak with each other to ensure their own survival. So you see these sort of like colony-based formations with other infections. And then of course, comorbid infections or conditions. And that was what I talked about earlier with the great imitator, the idea that you may just be dismissed completely because people are going to say, oh yeah, you have fibromyalgia, or you have chronic fatigue, or you have Parkinson's or something, or multiple sclerosis, when in fact, if your doctor was to look a little further, we might see more.
Hmm.
Yeah, now let's see that slide.
Yeah.
All right, so yeah,
No
so
problem.
because of all this, because of all this, we have a problem. So traditional testing, as we know, is really, really unreliable. And when we look at culture positive cases, so there's nothing to argue here. We see that the two-tiered test is missing, like, conservatively, it's saying 35 to 50%. We know it even may be more than that, like close to 60%. We'll get these false negative rates. And ultimately, the part that even providers aren't aware of, we're all taught, if you go and ask for a Lyme test, you get this two-tiered test. But that test that you're getting, this IFA or ELISpot, or I keep saying ELISpot, this IFA or ELISA followed by the Western blot, was only designed as a surveillance test, as a way for the CDC to track the spread of Lyme disease through the country. It was never actually intended to be clinically diagnostic. It meets those criteria, great, but there's a lot of other reasons. And the CDC itself says Lyme is a clinical diagnosis. So ultimately, there's several things. One is, if things are not explainable, it obviously means you probably want to look a little further into this, do some additional testing that's going to improve that sensitivity. And there's a whole bunch of things we can talk about and will, or do some sort of treatment intervention, whether that's an antibiotic or an herbal protocol, but something to see if you actually get some results. It shouldn't be just dismissed if there's some potential that you live in an area, or you've had, you trace things back. But most people don't even remember a tick bite who have chronic Lyme. I think it's 25% of people don't even recall having a tick bite. And that can be due to nymphs and other things, but I could go on and on about this. So.
Well, I want to just switch gears really quickly, because I feel like I left everybody off on a cliffhanger. Heather's here today because she's doing so much better. Heather, share with us your success story, how you healed. Give us the insider tips of what you walked and experienced.
Well, the insider tip is not to just focus on killing. That was sort of my experience. We focused on killing, killing, killing. And we did not look at the entire picture, the entire toxic bucket, pathogenic bucket. We didn't look at mold. There was so much that was missed. So, what really made a difference for me, number one, was addressing nervous system dysfunction, which often gets missed. Addressing water damage in the home. Everybody I work with who has chronic Lyme, when they find me, they're always in a water damaged home and they don't know it. And it really keeps them unwell and suppresses their immune system and adds to the toxic burden of the body, and can mimic those symptoms that people with Lyme present with. Then opening drainage pathways, so that when we're killing Lyme bacteria and parasites, and those pathogens can leave the body and not add to symptoms. So our bowels, our lymph, our liver, and our kidneys are the biggies. There are others, but those are the biggies. A big part, probably 80% of my healing, because I was sick so long, was really nourishing my body at a cellular level, and eating foods that were very high alkaline. And my gut was really a mess when I got started with having SIBO and being down to 10 foods. So for me, having liquid shakes like worked really well, because they were easy for me to absorb and digest. And the shakes were super alkaline, and they were supporting my detox pathways, especially my liver. They were bringing down inflammation quickly because they were so high alkaline. And over time, eating that way can start to starve pathogens, which I didn't experience right away. I experienced later on, after about 18 months doing this, where parasites were dying and I was seeing them, in the toilet, and I wasn't taking anything to kill them, which was pretty crazy. I did have to address killing. I did have to address killing bacteria and parasites and viruses and mold. I personally did that herbally. I never took an antibiotic at all to treat my chronic Lyme. just never crossed my mind to do that. I did work on detoxing. That was a huge piece of my healing. And I had to work on healing my gut because it was pretty messed up from living in mold my whole life and having just undiagnosed Lyme and parasites for such a long time. So it was a process. But once I found this approach, pretty much within 3 months, my brain fog had lifted. I did not need to go to a chiropractor ever again after 8 years of 3 times a week. At 6 months, I was getting rid of assistive devices and starting to be able to walk on my own. And at 23 months, my naturopathic doctor who did Lyme, mold, and SIRS said I didn't have Lyme, I didn't have mold, didn't have SIRS, didn't have Graves' disease, and pretty much I had reversed about a list of 20 illnesses. Now, at that point, at 23 months out, I wasn't sick, but I still had a lot of baggage in my system from all the years of undiagnosed being in mold. And so I still, my body for the next 2 years was continuing to release pathogens and toxins. It was a crazy journey.
Mhm.
But at this point, like I'm no longer sick. I'm hiking, I'm biking, I've re-entered the world. I'm health coaching. I'm helping other people. And my desire is really to give people hope that no matter how long you've been sick, you can restore your health. It is going to be a process. It is going to be work. But if you have the desire and the willingness, if I could do it, being sick at the age of 30 and I'm now 60, trust me, you can get there too.
Thank you so much, Heather. It's so true. Thank you for being such an inspiration to our talk today. Cory, let's talk a little bit about the treatment of Lyme, because I know everybody's path is different, but we're curious, what is the recommended, or traditional path, if you will, and give us some more insight on that, please.
Yeah, so I think it depends on where you are and the recognition point you're at. This slide is a good example of this. If you know that you've actually been bitten by a tick, you're going to want to kind of put it on the calendar. A lot of people just sort of forget the fact that they went camping, but if you develop symptoms within, say, 7 to 30 days, generally it's sort of that 10 to 21 day window. And those symptoms are generally very vague. They're more like flu-like illness. So, body aching, sometimes you get fevers, sometimes you get, insomnia or fatigue, like things that are not generally like what we all think of. You want to take note of that and see a provider or actually start a protocol as quickly as possible. If the tick itself has been attached for less than 12 hours, ideally less than 6 hours, your luck is better. But the duration of the tick bite itself doesn't necessarily guarantee that you can't get an infection. And they've actually found that ticks that are attached as short as 10 minutes can actually still transmit, because ultimately, if that tick is squished or any other thing, it can, again, regurgitate into you. The bullseye rash, it's one of the things that everyone asks about. It's pretty uncommon. And when you think, you look on Google or you look in a dermatology textbook, it's always going to show you that perfect bullseye, but that's not really how it looks for most people, aside from the fact that only 15 to 30% of cases actually have the bullseye rash. Generally, it probably 5% of the time looks like a bullseye. A lot of times it's just sort of a spreading red mass. And again, fewer than 50% of people recall any rash at all. So,
Here, I'll move on to the next one here. Continue, please.
yeah. So like I said before, that initial stage of infection generally starts in that sort of 7 or 10 to 21 day window from a bite, pretty vague, headaches, fatigue, feeling more moody, things like that. It doesn't happen in everyone. A lot of times, like, again, it could be that you're just sort of this progressive, like I feel more and more tired. Maybe it's like I'm not sleeping well. Maybe it's stress from my family. But ultimately, if things don't shift, like I tell my patients, like, try and stop making excuses for why you're feeling unwell and start looking into other potential reasons. So yeah, the appearance of any sort of like progressive symptom following an outdoor trip is reason to have concern. Of course, if you do get the erythema migrans or a bullseye rash, or any of these sort of systemic symptoms, you can always go on to ilads.org and look up the the standard of care treatment with antibiotics, which can be done in that first, again, you want to do it within the first 6 weeks of getting infected to ensure that you don't need to go longer than that. Of course, there's, as Heather mentioned, herbal options, both for prevention as well as for treatment to resolve these as well. It's not to say you have to do antibiotics, but it is noteworthy that there is a standard of care, and it's not going to follow what you see from, a lot of Infectious Disease Society of America sort of following the standard of care, which is like 7 to 10 days of antibiotics. I would discourage anyone from doing that. If you've ever had a tick bite and you were given that, the worst is the 1 day. If you're given 1 day of antibiotics, it's like it's criminal, honestly. But even 7 to 10 days is a problem because it doesn't fully resolve these infections. And what it really does is it blunts the antibody response. So you won't ever test positive based on those indirect antibody-based tests. Your immune system never develops a response. So what happens, and we see this a lot, is people have this story of, I got a week of antibiotics or a day, and then I was sort of okay, but at 3 months or 6 months, like everything sort of, the wheels fall off and everyone starts to feel badly. And it's because that infection was never completely resolved. And then unfortunately, like the standard of care test, these, an immunoblot, say, if you even skip the ELISA or the IFA, it won't be positive because that antibiotic was given in that first week. So you need to do direct, like, molecular testing, like, again, like a digital PCR or an RNA fluoroscopy or a T-cell test, which I think is a really accessible and good test, and I can get into further as we move forward. So yeah, this really essentials of treatment, and this is a short list. Number 4 is really, reflecting on Heather's story. It's an important one. And I discussed earlier this idea of your inflammatory load, how much your body can handle. A lot of people probably do have Borrelia or other organisms that they may be functioning pretty well with and doing okay. And a lot of times you get some other thing like a mold exposure or another infection or some major emotional stressor. And that's what ultimately drives that inflammatory load up. And then the proverbial sink is overflowing and you feel terrible. But, so for the essentials of treatment, need for detox, like supporting routes of elimination, and helping the body to keep its health, right? Like whenever we deal with chronic illness, I tell my patients all the time, you're not just treating what's wrong with you, you're always needing to fix what's not right with you. And I think that's a concept that's lost on a lot of people because you don't want to always just be disease focused, as Heather mentioned, and just look at the organism. You also want to be health minded and try and focus on how you keep people well and restore their own, their own bodies to function. And that includes like immune competence. But the ultimate core fundamentals of killing is going to be the antimicrobial, right? Whether that's herbal or pharmaceutical. Immune support, things that are going to help your body to clear these infections. Your immune system is broken into your cell-mediated or innate immune system and your adaptive immune system. And a lot of times Lyme itself can shift the balance and create this sort of adaptive immune dominance. We call it a Th2 dominance, where you get a lot of inflammation, but you don't get a lot of action. So it's sort of like a lot of yelling without a lot of, actually, help that your body's doing. And so from an immune standpoint, like, again, Heather mentioned, whether it's ozone or herbs or other things, you want things that are going to drive the innate immune system, your natural killer cells, your neutrophils, your macrophages, increase the quantity, the fraction, as well as the vigor of those cells so that they can get rid of those. And then biofilm treatment is critical. If you have chronic Lyme, you have biofilms, and ultimately Lyme itself has different morphologies. We all think of that spirochete like we've seen pictures of, but it also has forms like its colony form. We call it an L form, and those are generally what you see in these biofilms, as well as intracellular forms that can be both cystic or this sort of mysterious persister form, which is a state where the bacteria itself is able to more or less go into almost a state of hibernation to avoid your immune system and or antibiotics. And this is where a lot of times things like herbs are superior to traditional pharmaceuticals, and why ultimately some people do better with a purely natural treatment, or most people will do better with an integrative approach where you're combining the best of both worlds.
Mm.